Hey there, and welcome. I'm Anna Hartman, and this is Unreal Results, a podcast where I help you get better outcomes and gain the confidence that you can help anyone, even the most complex cases. Join me as I teach about the influence of the visceral organs and the nervous system on movement, pain, and injuries, all while shifting the paradigm of what whole body assessment and treatment really looks like. I'm glad you're here. Let's dive in. Hey, and welcome back to another episode of the Unreal Results podcast. Might not be a surprise to those of you that have been listening for a while, but this episode probably going to be, I don't want to say rambly, but a little rambly, because I don't have like a solid topic or case I'm sharing today. Just wanted to sort of like riff and reflect and maybe even like talk about what's coming up for 2026. Reflecting on this past year, reflecting on, just the focus for serving you all better, serving my patients better, serving my family better, what the plan is. So here we are. It's the end of the year, which is built-in time of year to be reflective, which is nice. I'm not a big, here's my New Year's resolutions or anything like that. And I'm not a big, start January 1st, I'm going to change my life. By no means. But I thought it would be a good time to kind of reflect on the focus for the year for myself, for Movement Rev. And just, as you, and just reflect. As you know, if you've been here for a while, if not, welcome. You're going to find out. A lot of the learning I've done in my entire career has been also through learning in my own body. Early on in my career, I knew that one of the things that set me apart versus other clinicians, especially working with my athletes, was I had a lot of athletic injuries during my athletic career. I'd torn my ACL, I've had meniscus tears, I broke my foot, I've had sesamoiditis, I broke my radius, I've had an internal or external reduction. I had back surgery when I was 29 with motor loss, like a dorsiflexion loss, a foot drop. I've had a subluxed shoulder. I have a hip labral tear. I have hip arthritis. I mean, I've experienced a lot in my body. I've also, had digestive issues that have been orthopedic. I've had just, and again, I've learned the relationships between orthopedic stuff and movement, performance, visceral things, and orthopedic things, in real time, not only for my patients, but in my own body. So I like I said, early in my career, I realized that this was an asset, and it gave me a way to be maybe more empathetic to what my clients were going through, but also to recognize signs and symptoms of what they were feeling. I remember early on some of my athletes when they would complain of this range of motion, blocking feeling in their knee after knee surgery. And I'd be like, oh, I know exactly how that feels. And so when they described it to me, I was like, yeah, felt that in my own body. And maybe for me, I've also learned that though I have a tendency, in regular school learning to have a photographic memory, I'm also a very kinesthetic learner. Because I'm a very kinesthetic learner, trusting, I wouldn't say trusting what I feel in my body has always been the truth, but I have learned to trust what I feel in my body to be a good teacher for me. And I've learned how being able to get the body agency, body ownership, body autonomy back has allowed me to filter out a lot of movement truths in the industry, as well as regulate my nervous system in order to be a more calm, regulated presence for my patients, which allows me to feel better with them. And I've talked about this before in many episodes, talked about it really 2 episodes ago. I'll have Joe link that in the show notes. And then I just did a quick search. I think it was episode 88. I also talked about it quite a bit too. And so learning from my own experience is good. And it's funny because I actually see this in my courses a lot. People will come to the LTAP Level 1 course as a clinician. And at the end of the day, they're like, when they start asking questions, they finally sort of tell me, oh, well, I'm here as much to solve my own problems as I am for my patients. And I think that is like a fundamental truth of sort of like how we operate through the world. At the end of the day, everything we always do goes back to how it serves ourselves. And that might sound very egotistical, but that's just the humanness of things. Even, and I've talked about this in previous podcast episodes, even the very martyrish approach of looking at we're caregivers and we like to care for people, and like, isn't that so kind that we put others first and care for them, sometimes at the expense of caring for ourselves. Like, somebody, some people would look at that and be like, that's not egotistical. But when you really like boil down and like unlayer the why behind why we do that, it always sort of comes back to self. It comes back to, I take care of others because it makes me feel like a good person. It makes me feel worthy. It makes me feel enough. And so it's like, okay, yeah, that comes back to itself. So often I notice in courses, both for myself and with participants, we're all there to help ourselves in one way or another. And it's a beautiful thing that part of what helps us is helping others. And often those of us that are caregivers, that's what makes us tick. And there's no shame in that. That's not an egotistical thing. That's not a bad thing that we get our validation and dopamine hits from being taking care of other people. It's just nice to realize that at the end of the day, it's actually it's still selfish. Still a selfish reason. And anyways, the reason I bring that up is because as I like reflect on sort of like what I'm focused on right now, and then oftentimes like what I often share on the podcast, and this is what I mean by, if you've been listening a while, you know this, like last year I had that severe viral pink eye, and so I shared about that, and I shared about that throughout the year as I struggled with the aftermath of a severe eye infection. And I'm also like a big, like, if something's going on in my body health wise, I want to learn everything I can about it. It's how learning is how I cope with worry. When my mom was diagnosed with lung cancer, how I coped with it was learning everything I could about lung cancer. It's a control thing. I find that if I can gather enough information and create an actionable plan, it feels like I have control over like things that maybe you wouldn't feel like you have control over. So I 100% know that is like my default. And so I almost get obsessive when something's going on and I learn about it. It's like all I want to learn about. It's all I want to talk about. It's like, and my patients are like that too. When I have a difficult case, that's like all I want to learn about. I dive in the anatomy. I like review things, and it's great because it supports this core value of me always learning. And but I do recognize that it's like a form of like obsessiveness about like how to control and take action around things that I have anxiety or worry about. So anyways, which so that means like on social media, on especially on the podcast, I share a lot about my own health journeys. And I don't know, like, is that good? Is that not good? I don't know. Like, why not? Like, who cares? I feel like sometimes when it comes to health and things that happen in our body, people are so don't share about it. For whatever reason, like sometimes it comes from like bodily functions. You don't want to be like you're ashamed of them. And I'm like, there's nothing that happens in our body that we should be ashamed about, because our bodies are amazing, and we're all in these meat sacks together. Like, and we gotta make this last our entire life. And so it's like, why not talk about it? And then also, like, the state of healthcare is so poor, and I feel like the more I talk about my experiences and like my knowledge around what's going on in my own body, it empowers all of you in your own bodies, and then like helps you advocate for your patients, which is, and your family members, which is so important. So anyways, I had after I was talking about my pink eye a couple episodes ago, I had somebody email me and they're like, "Hey, it's so good to hear that your eyes are doing better. Like, whatever happened with your tongue tie?" And I was like, "Oh, I totally forgot about that." And I'll have Joe link that in the show notes. I did a whole episode on tongue and tongue mobility and stuff. And after taking Dr. Perry's tongue mojo course and like going down this rabbit hole, feeling like I had a tongue tie, which I do believe that I do to a point. I even did like a myotherapy appointment and was underwhelmed by it. I'm sure maybe if I had tried a different practitioner, maybe the outcome would have been different, but I never got it. I never had surgery on it. I don't intend to have surgery on it. I don't even think it's that bad. And honestly, I I do some tongue mobility exercises here and there, but kind of not consistently. And it was just kind of made me laugh. I was like, oh man, I've really taken my podcast listeners on a journey of my body. So I was like, sometimes I think, like, should I share everything or what? But so I'm like, whatever. This episode, I'm just going to share with you some stuff that's going on. And it was interesting too, because last episode, I had a guest on Dr. Satya. And one of the things that was really interesting was, I mean, I met her back in August, but I've been thinking about it a lot because at my last eye doctor appointment, I had like good news, bad news scenario. We're like a year post pink eye. And finally, the white spots on my cornea that was causing the blurry vision have gone away. The doctor was like, there's literally no evidence of a severe infection any longer on your cornea. So that was great news. But he was like, you still have dry eye and you probably will forever. So he's like, you continue with the meds if you'd like, and all the, self-care practices you're doing for dry eye. But in that appointment as well, he dilated my eyes and actually got a better look at my optic nerve and, did a more thorough eye exam than he's done. And he had told me he wanted to do in the last one because he's like, you've been under my care for about a year. And since you were a new patient, I've never done an actual like annual eye check on you, which is when you get your eyes dilated and they check all the things about your health and your eye health. And honestly, I've done that before, but it's been a really long time. I can't even I honestly, when he asked me the last time I got my eyes dilated, I was like, I have no idea. It was a long time ago. And the reason for that is like, I forget it's an important doctor's visit to do regularly, like an annual physical. And so, yeah, and also like the reason why I've never looked at it is I don't have vision issues. Like I've got 20/20 vision. I've had 20/20 vision my whole life, if not 2015. And I'll have like some eye accommodation issues here and there over the years, but it always clears up with some eye exercises. And I have never really needed a prescription. Like, I have a prescription, but it's like very mild. I've been told here and there along the years as I've gone to the optometrist for just a general eye exam that I have like a really mild astigmatism. So, but it's one of those things that it's like, I don't have eye issues. It's not a big, like, on my radar to do regular checkups of my eyes. And I feel like because all the different specialties of doctors don't really work together, I feel like it gets lost in the mix of like all the stuff you're supposed to do. You're supposed to get an annual physical, and you're supposed to get an annual like female like pap smear, but it's like they switch from annual to be like every 3 years or 5 years, but unless you're sexually active with multiple partners, and it is every year. And but that just screens for cervical cancer. That doesn't like look for like ovarian cancer, so you still have to have that on your radar. And then you have to get mammograms, and then if you have a certain like genetic predispositions, you need breast MRIs too. And then you also need like colonoscopy. I needed an upper endoscopy, and it's like all of this different stuff. It can, like, as a healthy person, it feels overwhelming, because then you got to do fucking your dental checkups and like deal with your dental health, and like there's just like so much. And it's like, who organizes that? Like when we're younger, our parents keep track of that, but then you become an adult and all of a sudden you're supposed to remember all of these things. And some offices are better than others at like, making sure they follow up with you on those like annual things. But at the end of the day, it's tough. And then when COVID happened, everything got pushed, right? Like if you were pretty regular for that kind of stuff during COVID, when everything kind of shut down, like those types of appointments were pushed off because the system was overwhelmed with actual ill people. And so, anyways, the whole thing is like, yeah, I didn't even kind of remember that you were supposed to do annual checks on your eyes, like getting your eyes dilated. So anyways, so we did my eye dilation, and I have like borderline ocular hypertension, which is high pressure, and I have borderline optic nerve cupping or atrophy, and which basically like those two things together are called, I think I forget if it's open or closed angle. One's acute and one's not. But it's basically the beginning of a glaucoma. And a glaucoma is basically like you lose your vision because your optic nerve atrophies. And he said it very like nonchalantly, like it's a big deal, but it's not a big deal. And he's like, I want to have you come back in a month to do more testing. And I think he didn't really say what the more testing was, but I'm pretty sure it was like a visual field test, because sometimes the first thing to go is your peripheral vision. So people who have glaucomas, eventually you get like this tunnel vision, and it's like you're looking through a straw basically as you lose your vision. And it is like the number one like reason for losing sight. And it's not like curable, which is like, what? When he told me that, I was like, excuse me, what? I have what? And it's and it's crazy too, because doctors say stuff like that in their offices, and maybe like they're used to people not knowing anything. And so like he didn't really give me a lot of information. He kind of just said it. And he didn't like say it as glaucoma, but he kind of did. And then he was like, okay, well, in a month we'll like check some other things and like figure out a plan. And I was just like, what? So of course I'm like, wait, first of all, how is this not related to my severe infection? Like, it would make sense that after a year of well, after how intense my pink eye was and how I've not felt normal in my eyes for like a year, I'm like, how could any sort of high pressure not be related to that? And even every visit that they saw me over this pink eye journey, they would take my pressure, and my pressure would like bounce around between like 17 and 20 milligrams of mercury. So high pressure is over 20. I think it's like 21 or 22 is technically considered high pressure. But they were like, oh, especially when I was still on the infection, they're like, well, it's like borderline, it's you're good, or they'd retake it and it'd be fine. And so, I mean, and they check the pressure two ways. So they check it in the office always. They put these little like numbing drops in, and then they do the poof of air in your eye that checks the pressure. So that's what they were measuring at first. And then when they can finally dilate your eye, that is a more accurate measure of the pressure. And so this is the first like time I guess they got a more accurate measure of it. And both eyes were high pressure. Borderline. So it's like, I'm borderline high pressure, which means I could just as easily be borderline normal pressure, right? You have glass half empty, glass half full sort of thing. And then the optic nerve cupping, I'm also like borderline on. I forget the measurements, but it's like right on the border. And so, bright side is, as sucky as that pink eye experience was, had I not been under the care of an ophthalmologist, I probably would never have done an eye checkup like that to get my eyes dilated and checked. And so, I might not caught this until I started to have symptoms, So glaucomas in general are called like the silent sight takers or silent sight whatever, because there's not a whole lot of symptoms of ocular hypertension. And so, and also the symptoms are very similar to the symptoms of dry eye. And so I'm like, now I'm going down this rabbit hole of like, I've had a headache for a while. I also had a really bad cold, as you know. So it's like, is my headache sinus congestion and pressure? Is my headache ocular hypertension? Is my headache hormonal? It's just like, and then of course you look up all of those types of symptoms, and all of those types of headaches are sort of like right behind your eyes. And so that also, like, now I feel a headache behind my eyes and I'm like, oh great, like this high pressure, I'm going blind. And so I'm like, ugh. So anyways, this whole long story to tell you, and how it connects back to Dr. Satya, is, when I learned from her at the Fascial Research Congress, she like basically shared her story about her Chiari malformation and like her pressure issues in her cranium, and how she helped herself avoid needing a surgery for that through working on her body and working on what she describes seeing at it through this lens of this neurofascial flow lens, and the looking at it through the dural kinetic fascial chain. And so it was just interesting that like I started hearing from her around this time, because of course when the doctor told me this, in my head, because I know from my visceral learnings that all of our visceral containers are pressure oriented. And even though the eyes and the intracranial pressure are talked about differently, like at the end of the day, I can't imagine that increased intracranial pressure and increased ocular pressure don't have some sort of relationship together. And so it's like, or even so, if you just want to look at it as a separate container, it's still a container, right? And so I'm like, everything's all attached. And I know, well, you can change pressures of the containers via other containers. And so, when I was looking into learning more about ocular hypertension and learning about glaucoma, I was like, wait a second, hold my beer, Dr. Patel, because you might think that only treatments for this are laser surgery to decrease the pressure in the eye, or eye drops to decrease the pressure in the eye and monitor the atrophy of the optic nerve. I was like, but for me, I was like, no, 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 no. We're going to go from a movement standpoint of like all the ways that I can affect the pressure in my eyes and in my head through understanding the whole organism. And also, I'm going to approach it from a functional standpoint of like, okay, I have neurodegeneration. Like, let's like what supplements can I take to support optic nerve function? What supplements can I take to support free radical buffering and like like antioxidants and like decreasing neuroinflammation? And like, how can I approach this from a more whole organism systemic standpoint? And I was like, the outlook is grim when you look at like the normal talk about the glaucomas and this kind of thing. I was like, but I'm like, okay, good to know that this is something that's going on in my eyes. And the experience with pink eye made me realize like, holy cow, like the threat of losing my vision is not something I will ever want to experience. And so I'm like, okay, dive into learning all the things and doing all the things and taking action. And so, that's one of the things that I am like focused on in my own body. And also, these kind of questions come up in our Movement Rev education community quite a bit. As like, I have a patient with XYZ, neurological condition. Like, how would you approach treating it besides, utilizing the LTAP to direct you where to treat when the sequence of treatments? But like overall, my thought processes are like, how can we best support all of the pressure in the different cavities, especially in the cranium and the fluid flow and that kind of thing. And it's one of those things too I've shared for many years now, like that I struggle with lymphatic congestion. That's kind of like the default for my body. I do think I have like a level of lipedema, and so it's like, it does cause me to be a little bit more lymphatically congested on top of like just the way my body responds to stress and things like that. And these are things I've learned from working with my doctor, Dr. Amy Chadwick, who is a naturopath that's trained in endobiology, which is like the, looking at how the endocrine system is like the biology of like how everything works together as a whole organism standpoint. And so, I'm starting to understand like more systemically from a physiological standpoint how everything is like connected and how to kind of unwind it. And it's like, so I'm working with her for functional things. And then I know things from a structural standpoint that I can do to support the pressures, the fluid flow, and those kind of things. And so, that is like a big focus for me in my own body in 2026 is like, yeah, like, okay, cool. You can measure pressures like that. Well, let me do all these movement things and see how it changes. Now, what's interesting too, when I reflect back on just my eye health, I was already very aware that oftentimes, sometimes when my eye function would ebb and flow, it was very interesting how it connected, even from an visual acuity standpoint, how my visual acuity changed at the different parts of my life where different movement strategies were prevalent. And so I'm like, oh, that's really interesting. I wonder, it just makes you wonder like, oh, I wonder if that was like the pressure on my optic nerve, if that was more the relationship between the suboccipitals and the eyes from a focusing standpoint. That was more the, control of the eyes. It's like, there's so many potentials for that, but it's like, yeah, I already know, like I have proof. I know that I can change my visual acuity from improving my container, my structure. So I'm feel fairly confident in that I can change this ocular hypertension and like set myself up for stopping the progression of optic nerve atrophy, at least from a pressure compression standpoint. And then, I got to trust that the neuroinflammation markers and like physiological things that I can do is going to be supportive for that too, right? Like, bless that here we are moving into 2026. Like, there's so many more people looking at neuroinflammation and neurodegenerative diseases in general. Like, what a time to be alive. Like, maybe in my lifetime we will find a cure for things like glaucoma that traditionally didn't have one for. So I look forward to this learning experience in my own body, and applying, I don't want to say like my life's work, but applying like a lot of what I do to it, right? Like, it's like, yeah, this is exactly the plan I would give a patient. So I'm like, yeah, I'm going to like do what I tell my clients. So anyways, that's where we're at there. With that said too, like I'm leaning into really enjoying being at home and slowing down a little bit and not always constantly being on the go, like getting some, I don't want to say roots, because that feels very like permanent, or that feels very like stagnant, but like, yeah, like, one of the things that we're focused on in the mentorship this next year, so the 17 people that are in the mentorship, we're all about like making this transformation to become the calm, confident go-to practitioner. And one of the things I'm focused on like helping lead them through over the 12 months is the calm and confident piece. And the calm and confident piece really goes back to like slowing down and taking care of yourself and being intentional. And one of the things that, and probably like my word for 2026 is like inhabit. Like, I'm going to inhabit like being in my body, caring for my body, inhabit like being in San Diego, caring for my relationships here with friends and with my clients here, and myself, and not pushing so much, right? Like, just realizing that, yes, my default is always to like go, go, go and take action, which is great. I love that about me. But also, like, can I take action calmly? And can I take action intentionally so it's consistent in doing the foundation to actually get more out of the 12 months than I would when I take action quickly and have periods of push so hard that then I'm exhausted and have to take months off, or like back off, or just feel like I can't be as present for myself, for my family, for my clients, for my home, that kind of thing. So, and one of the things that, this has been on my mind for a while now, and I think part of it is like maybe my age, maybe just like not feeling happy in my own skin right now, but then also like leading this group of people through the mentorship and through this transition, and like realizing like, oh, I need this too. Like, often we are such a mirror for each other, right? Like, oftentimes what we're speaking to, what we're coaching people through, what we're saying to people, even sometimes when we're doing assessments on people, if we're finding the same thing coming up on multiple patients, often that's actually their body mirroring to us what we need in our body. And so like realizing that is just like, okay, like, I hear you, here are the messages, and like, I'm ready to accept, I don't even want to say the challenge, but I'm like ready to be like, okay, let's take care of it. Let's do the thing. So anyways, oh, and shout out actually, because every time it comes to like end of the year, like choosing your word for the next year, like, have a hard time like articulating what the perfect word is. And it's like, I knew what my goals are, and I knew some ideas of like what I wanted to focus on for next year, but I didn't really kind of see the red thread of it all and like how it all worked. And so I actually shout out to Lex Lancaster in her email today. she shared how she used ChatGPT to help find a word. And basically she said, write out your goals for the year. And then ask ChatGPT to help you with picking a word for the year that's specifically a verb that encompasses all of those goals. And then of course I asked ChatGPT, if it's not specific, if my goals aren't specific enough, let me know. I can get more specific. But, I shared my goals for both personal and professional. And I said specifically for the word of the year, clearly represents these items, specifically give me a verb. And it was like, oh yeah, the primary recommendation was inhabit. To fully live inside your body, your work, your relationships, and your environment without rushing ahead, bracing, or overperforming. And I said, this word quietly does everything you named. And so I'm like, oh, actually, and then it broke it down through all the different goals I had. And I was like, man, that is a really good word. And so I love it. Like I said, it's very similar to rooted. I think if I hadn't have asked ChatGPT, I probably would have landed on rooted or calm or being something like that. But inhabit is perfect. So that's the goal. And I'm going to try to keep that in mind as I work through 2026, and who knows what the year will bring, but I am excited about it nonetheless. And, looking forward to continuing to share with you my journey about changing the pressure in my cranium and my eyeballs. Good news, that's going to change the pressure in all my containers and make for a healthy viscera anyways and better movement. I'm going to do some more learning in my body. I am actually also enrolled in Matt McInnes Watson's plyo intensive that starts in January. So I'm super excited about that. I've been feeling an itch to start running, which is wild. I'm not a big runner, but there's been times in my life that I just feel like going, being a runner. And so I'm here, I'm at that point. And, yeah, so I'm excited about those opportunities, and, can't wait to bring more episodes of the Unreal Results podcast for you. I have, quite a few more guests I want to bring on next year. So next year might bring a few more guest episodes than I've been doing in the past, and I hope you enjoy those. And other than that, we'll keep talking cases, and we'll keep talking about this whole organism approach, and looking at how the viscera and the nervous system influence our orthopedics and our movement and our biomechanics, and getting all of us to appreciate a more full picture, a more whole organism picture of structure and function, or container and contents, and just how we can serve our people better, get better results, unreal results, and have more fun doing it. Because at the end of the day, that's what it's all about. I want everybody to actually feel recharged from every patient session instead of burnt out. So cheers to 2026. See you next time.